COVID cases are climbing. Connecticut's positivity rate is now hovering just under 3%. That is up slightly from yesterday. Right here are the latest numbers for you just into the newsroom this afternoon. We're now at 2.96%, and there have been another 391 cases in the last 24 hours.
Now, the CDC says people in hotspots should be wearing masks indoors, but what does that mean for us here in Connecticut? Health officials here looking for a lot more guidance. Channel 3 Eyewitness News reporter Mike Savino is live in West Hartford tonight. And Mike, is anyone defining what exactly a hotspot is right now?
Well, not yet, Erin. I even talked with the governor today, and he said he plans to be talking with other governors and with health experts to try to narrow that down. Now, we did have a way of defining it back in the fall, but now we have the vaccine, we have a better understanding of the virus, and the governor says he wants new metrics that give more flexibility.
I think what we need is something locally to help us determine what's going on in our state.
A day after the CDC revised its guidelines on mask wearing, public health experts still have questions. The CDC says everyone, even the vaccinated, should wear masks indoors in hotspot areas. But what does that mean?
I'm talking to my fellow governors about that.
Back in the fall, the state set a tiered system that puts towns into a red alert if they average 15 cases per 100,000 people over 14 days. Under those rules, Franklin and Salem would both be under a red alert for COVID. Lamont says he wants to look at other information to see how much the virus is spreading. Health experts agree a fuller picture is needed.
There has to be some context with looking at some of these metrics.
That could mean looking at vaccination rates, positivity rates, and other indicators to see the true risk of a spread in each community. Meanwhile, some states are upping their vaccination efforts. New York Governor Andrew Cuomo is requiring all state employees to get the vaccine or take regular tests to report to work.
Not something we're announcing, something I got to think about and look at.
Lamont has not reached the same decision. In fact, he said today he's not sure if he has the authority to do it. Instead, he wants people to see getting vaccinated as the right thing to do, and he criticized the Food and Drug Administration for not fully approving the COVID vaccines, saying the emergency youth authorization is causing some people to wait.
We've gone from Operation Warp Speed to Operation Slow Roll, and they still can't decide whether to give the full authorization for these vaccines.
Now, I did have a chance today to talk with Franklin's first selectman to get his response about being under this red alert under the old metric. I'll tell you what he had to say coming up on Eyewitness News at 6. For now, live from the mobile newsroom, Mike Savino, Channel 3 Eyewitness News.